This lecture is about facial muscles, so the muscles that create our facial expressions, and the muscles of mastication. Mastication is chewing, so muscles that are involved in moving our jaw to chew food. All right, so I'm going to start with this kind of crazy busy slide. This picture is a typical picture that you would see in your textbook that has the muscles all listed on this picture. But instead of talking from this slide or this picture, I have found images where the muscles are isolated so that you can see them a little bit better. But we will cover the slides. We will cover the muscles that I have highlighted here. Green is to represent facial muscles or muscles used for facial expression, and red is for mastication. It is also, I think it would be worthwhile to have the lab activity printout alongside of any of the lectures that I do on muscle, because the lab activity lists the muscle in a nice table format with the origin, insertion, and action. And I've highlighted what I want you to know. So although I may go over all of the origins and insertions of the muscles, I've highlighted in yellow the only ones that I want you to know for origins and insertions. So I'm trying to reduce the amount of material that you have to memorize because it would be very extensive. So you always have to know the muscle and the action. The origin, insertion will be highlighted if I want you to know it, okay? So make sure to work alongside the lab activity. So again, I used KenHub to find images that I thought were a little bit clearer. So I'm going to stray a little bit from your textbook to use these images so that you can just kind of see the facial muscle a little bit clearer. Also, in the lab, we have heads that have all of the muscles that I'm going to go over. So your job in lab is to identify these facial muscles. So for a practical exam, I would point to a particular muscle on that model that we have in the lab, and you would have to recall what that muscle is. On a written exam, I might ask you about the actions of the muscle. All right, so let's begin. I just needed to give you that introduction before I started this lecture, but that introduction kind of pertains to all of the muscles that I will go over. I'll probably mention the origin and insertions all the time, but you don't always have to know them. So you need to keep track of that based on the lab activity. All right, another important feature about facial muscles is that the insertion site of facial muscles are skin rather than bone. So usually you have an origin on a bone and you have an insertion on a bone because you're usually spanning a joint and you're trying to move a bone. But in this case, and only in this case, the facial muscles will insert into skin because that is what is going to move, maybe our mouth or something so that we can create a smile or we can talk or show any kind of emotion. So that is the major difference between muscles of facial expression and all other muscles. All right, so let's begin with the first muscle, which is the levator labii superioris. And a lot of times the name tells you what it's doing. So anytime you see the word levator, that you can think of like an elevator, like pulling up, labii always refers to lips. And if it's in the superior position, it's usually higher up on the skull per se. So again, I'm going to go over the origin and insertion, but double check with the lab activity because I think I only highlighted maybe 2 or 3 that I want you to know. But I also think going over them allows you to kind of see where the muscle is placed on the skull, and it does help you to understand the action, which ultimately you do need to know. So the levator labii superioris has its origin on the zygomatic bone. It inserts into the lip, the skin of the upper lip right here. And so if you would imagine this muscle contracting and shortening, it's going to elevate the upper lip. So when I ask you for an action, I would prefer you say elevate the upper lip rather than smile, because smile is kind of generic, and there are a lot of muscles that create a smile that depends on the type of smile, whether it's a cheesy smile or showing all your teeth kind of smile, so it's not very specific. But elevating the upper lip is the answer that I would prefer if I asked it on a quiz or an exam. Okay, so again, in the lab, try and identify this on our model. We have a facial muscle head that has all of these muscles on it. All right, let's move along. So lots of times we have the opposite muscle too to do the opposite action. And it will have a name that kind of implies what it's doing as well. So a depressor is going to pull down. Labii is the lips, and it's in inferioris. So it's kind of the opposite of the other muscle. It originates here at the mandible. It inserts into the skin of the lower lip here, and you can imagine that if that muscle contracted, you would get depression of the lower lip. So again, don't use frown. I just kind of put that there so that you can get an idea of what kind of facial expression that is. But the technical term, I don't know why my iPad does that, is that it is depressing the lower lip. All right, moving on to the mentalis. You probably remember the mental region. All right, so this muscle originates at the mandible here. It inserts into the skin of the chin here, and it is going to protrude the lower lip. All right, orbicularis oris. Again, oris means mouth, so if you know your anatomical terms, you should be able to identify these muscles, and they may seem, the names of them may seem a little bit easier to remember. Orbicularis, orbic is like surrounding or going and circling or going around. So the orbicularis oris encircles the mouth. So it originates both at the maxilla and the mandible, and it encircles the mouth, and this allows us to close or purse the lips. Risorius is the next muscle. So it actually doesn't originate on skin or on a bone, It originates in the fascia around the parotid salivary glands. So the salivary glands sit kind of right below the ears. So there's a salivary gland that sits right by the ears and kind of the side of the cheek. So that's where the risorius muscle originates. And then it inserts here into the skin at the corner of the mouth. So the action is to draw the corners of the mouth laterally. So if that muscle contracted, it would pull the mouth laterally. And that would also create a smile. Here is another depressor. This one is a depressor. It's on an angle, so it's anguli oris, which is the mouth. It originates here on the mandible, inserts at the skin at an angle at the mouth, so at the corners here, and it is going to pull down. It's going to depress the corners of the mouth. And this would be if you were sad or angry. I don't know what happened to my spelling there. Oh, I guess sadness or anger. That works, actually. Okay, now we have a major and a minor. So sometimes muscles come in a pair, such as the zygomaticus. There's a zygomaticus major and a zygomaticus minor. And you'll see this throughout the body. There'll be like pectoralis major or pectoralis minor. Lots of times, as a general rule, and this is just a general rule, it isn't always the case, but it is often, the minor will sit above the major. Okay, so here is the zygomaticus major, and here is the zygomaticus minor. Here's a better picture of it there. So zygomaticus major and minor, they actually both have the same actions. That's not always the case in this, but in this example it is. So these muscles originate at the zygomatic bone, right here. They insert at the skin at the angle of the mouth, down here, and they are going to elevate the corners of the mouth. Elevate the corners of the mouth, and that's going to create a smile as well. All right, this is a deep muscle. So you also always have to take into consideration when you're looking at pictures and when you're looking at some of the models in the lab, how deep the muscle is. And sometimes the model will be divided in half, where they'll have more superficial muscles on one side and deeper muscles on the other side. That's often how our models are. So the buccinator is a deep muscle, meaning like you would have to take off layers of muscle before you can see the buccinator. All right, so the buccinator originates at the maxilla. Okay, so here's the maxilla, right? It inserts into the orbicularis oris. So that is the muscle around the mouth. And this is going to compress the cheeks like a blowing motion, or if you're whistling, that's the buccinator. All right. There are two muscles along the top of the skull that kind of act together. So there's a couple names to them. To keep it simple, I don't mind using frontalis. Okay, so let me show you. There's a frontalis and then there's an occipitalis. All right, so there's two muscles here and they kind of work together. And they are separated. If you remember when I introduced muscle, I was talking about tendons attaching muscle to bone. And I told you that in certain circumstances, there is a sheet, a tendinous sheet that is called an aponeurosis. I forget what lecture I probably mentioned that in. It might have been 4 or 5. So these two muscles work together and they are separated by an aponeurosis. So let me go back. So the frontalis, so it originates at this epicranial aponeurosis that I'm talking about. This aponeurosis is where the muscle originates from. So you can see it here. And it inserts into the skin of the eyebrows. So up in here. And what this does is it raises the eyebrows and wrinkles the forehead. And they kind of work in unison. If you try to work this muscle and at the same time feel the back of your head, you can sometimes feel that muscle gets in the occipitalis is engaged as well. So here is the occipitalis. It originates at the occipital bone here. It inserts into the aponeurosis as well. And it's going to pull the scalp back. So again, as you raise your forehead, it's kind of, think of it as one fluid motion from front to back. That's how the frontalis and the occipitalis, so you can call this the occipitalis. I'm fine with that instead, if you want. That's up to you. Occipitalis and frontalis give me an image, so that's why I use them, of where the muscles are and how they are working, okay? So again, it's going to pull the scalp and it's going to pull it back posteriorly. All right. The next muscle is the corrugator supercilii. And you may remember the superciliary arch that we talked about when we were talking about the features of the skull. This muscle originates in the frontal bone. So here's the frontal bone here. And also so it kind of dips down into the nasal bone region. It's going to insert into the skin of the eyebrows, and it's going to draw the eyebrows toward the midline, like a frowning face. All right, the next muscle is the orbicularis oculi. Remember, oculi is for eye. Orbicularis, orbic, is encircling. So this muscle originates in the frontal and maxillary bones. So here's the frontal bone here, and then the maxilla is down here. It's going to insert into the skin of the eyelids, and this is what is going to close our eyelids. This is not the same muscle that we use to blink our eyes. This is like closing your eyes, like you don't want to see something, so you're going to squeeze your eyes. You're going to close your eyes really tightly. That's the orbicularis oculi. And then the platysma. This is a very thin muscle that kind of runs from the mandible all the way down the neck. So the origin is around there's fascia around the chest here. It's going to insert into the border of the mandible, and it's going to be able to pull the mandible down. So it's going to depress the mandible, and it can tense the neck. That's the action. So again, the muscle and the action are what's important. Sometimes knowing where they originate and insert is helpful to kind of place where the muscle is on the body, and then you can kind of predict if it would contract what it's doing. So sometimes that helps you to understand the action. All right, so we'll finish this lecture with the muscles of mastication. There aren't that many muscles of mastication. That's chewing. Most of this work is not so much listening to a lecture and trying to decipher everything, all the topics that I've gone over. This unit is very different in that it is just really heavy in memorization, and you just kind of have to sit on your own time and look at these muscles and live by that chart in the lab activity and memorize it. All right, so the first one is the masseter, okay? And its action is to elevate the mandible. So this is a muscle that can get a little bit enlarged if you're grinding your teeth. So if you grind your teeth, sometimes the masseter can be really prevalent on your jaw, like the jawline. So it originates at the zygomatic arch. Here's the zygomatic arch. It inserts into the angle and the ramus of the mandible. Remember that? and that is what's going to elevate the mandible. So again, make sure that you're using the correct action. You can't just say movement of the mandible. You need to be specific and say elevate the mandible. The temporalis muscle sits on the temporal bone. Okay, so it originates at the temporal fossa. It inserts in the coronoid process. You remember the coronoid process of the mandible? And it is going to elevate the mandible. So the action, muscle, action, elevate the mandible. And then lastly, there are two muscles that help move the jaw from side to side. So this is going to give side to side movement of the mandible. And they are called the lateral and medial pterygoid. So the lateral pterygoid is shown in this picture. And then the medial pterygoid is shown here. These are very, very deep muscles. I'm trying to remember if the model in our lab even has these on there. We'll have to look at them when we get to the lab. But there are, I call them muscle heads. That have all of the muscles of the face and mastication on them. So you'll just have to double check. If you can't find a muscle on a model, you just need to know its action. So again, the medial and lateral pterygoid are going to move the mandible from side to side. So that will allow you side to side movement. And here is one final picture showing you again all of the muscles. This is from Ken Hub. I already spoke about Ken Hub, so you can see more superficial muscles on one side and the deeper muscles on the other side. This is them all together. However it is you want to study them. I just wanted to go over them separately, but if you want to study them all together, just make sure, like there are some that I didn't go over, so make sure that you're studying the ones that are in the lab activity and in the lecture. All right, let's move on to the next lecture, and I will see you in lab.